said it's this that I miss, and I'll have no regrets, 'cause it's you that I'm falling in love with again. Yes, it's you that I'm falling in love with again. Yes, it's you that I'm falling in love with again. It's you.
Aloha! I'm Airielle with Maui Arts and Music Association, and we have Mama Presents here for you today. And Mama is presenting to you a very wonderful Maui doctor. Her name is Dr. Julie Claire Holmes, and Julie is a naturopath. What does that mean, a naturopath, Julie?
Very good question. I get asked that a lot. Well, Airielle, a naturopath, first of all, you'll never meet two naturopaths that are exactly the same.
So it's naturopath, not naturopath?
Well, you could say it either way, naturopath or naturopath.
Okay.
But basically, a naturopath is a person who believes that the body can heal itself, and that if we support it with things of nature, that basically the body can heal itself. And so a naturopath is trained to use things of nature to assist the body in its own healing abilities.
Aha. So then when you call yourself a naturopath, I mean, I think that people don't realize that a naturopath is actually a doctor. You know, I think that a lot of people think, well, it's somebody that plays with herbs and does goo-goo medicine over their person, and I don't think that most people realize the training that's involved.
That's
for
true.
You. So
that's
I think
true.
it would be important. You did go to medical school? Does a
Well,
naturopath go to medical school?
First of all, let me share, some people call themselves naturopaths who are not licensed as naturopaths. So there are different kinds of naturopaths.
So that creates a lot
of confusion. But a naturopath who, for instance, who is licensed in the state of Hawaii, which is one of the states where you can be licensed, has gone to an accredited 4-year school, naturopathic school. So it's a medical school where we learn anatomy and physiology and gynecology and urology and all the ologies and pathology, and then after that we start to learn natural methods of healing the body. So we focus on learning about herbs and nutrition and how exercise affects the body and emotions, and some study acupuncture, some actually do home birth. So there's a tremendous variety, and our training is very rigorous, 4-year school after pre-med.
So you do pre-med in college, and then 4 years.
Correct.
So really what it is, it's lacking the 3 years that a regular doctor would put in.
You know what? One of the
major
differences, I'd say, is that we don't get to spend a lot of time in hospitals.
Practical, like internship.
We do have an internship, but it's done in a clinic and not in a hospital. So we don't get to see some of the things that we learn about in school. We don't get the chance to actually see them quite like other medical doctors.
I see.
Although more and more our schools, like there's one in Oregon, are connecting with the hospitals, and we're getting more and more hospital training.
Boy, that's so exciting. I love how that's taking place today.
It's pretty amazing. It really is.
Yeah, we had read in the newspaper the other day that, I can't remember exactly, I think it was that California had passed a law about herbs and acupuncture being an important part of treatment. So that's part of what alternative health care is. And so when we say that Julie is an alternative health practitioner, is that how you refer to yourself? That she works with many different kinds of alternative methods, like?
Well, in my particular practice, I use a lot of herbs. I also use homeopathy. I use a lot of nutrition. You know, I also do a lot of listening and
That's important.
finding out what exactly is going on, or why the energy of the person is not healing, where it's blocked. And so I do a lot of emotional, psychological work. Sometimes I refer for body work because that's important. I do gynecological exams. I'm quite eclectic in my approach. So I use many things. I use whatever works.
Well, that's the whole.
Through the years, I've learned a lot of things.
Yes, I really understand that. I have the same situation myself.
That's right.
And that's wonderful because we have the ability to apply a lot of different knowledge to what might be going on.
For each individual.
Unlimited thinking.
Right.
So, Julie has been, like we said, working with this since '82 when she got out of school. And I think what happened is her focus went to women's health care issues very strongly. And now she gives lectures on the island about menopause and PMS. And so today we want to put a strong part of the focus of the show on those items for all you ladies and you men who would like help for your wonderful women in your life. So why don't you talk to us a little bit about that, Julie? How did you get into the menopausal issues so strongly? And
Airielle, the truth about that is that more and more women would come to me in conflict about they really didn't want to do the traditional medical approach, yet they were concerned about osteoporosis, about cardiovascular problems, and about hot flashes.
And rightly so.
About their relationships,
I've been there.
Yeah. So women were coming because as we, the baby boomers, are moving into menopause, there's something like 40 million women entering menopause here in the next 20 years.
Wow, that's a big number.
So the need, and I'm one of the few naturopathic women, especially here in Maui. And so as women requested, I just kept going deeper and studying and learning everything I could from all the other practitioners and healers around, even from Europe, and started working a lot with natural hormones and
good for you.
Yeah. So basically it's out of need and interest, partly that I'm also a woman who's going to be going into menopause fairly soon. So
well, there's so many women, and this is it's very interesting to me because I love to work with women as well, and their empowerment and the changes that take place in the psychological makeup at this time is very, very wonderful. And if we can look at this time period from a different point of view, which I think, working with you and assisting yourself to be more comfortable during this time period.
That's true.
To understand that you don't have to be uncomfortable.
That's right.
It's
and also that each woman is an individual. So not all women are going to be treated the same way. Not all women need Premarin and Provera. Not all
sound
women
like big names.
Yeah,
Joy.
Those are hormones that are used by traditional medicine. And for some women they're fine, and for other women they're not.
What are those names? What do they mean?
Well, Premarin is commonly prescribed for women during menopause. It actually means that it's a hormone that's actually taken from pregnant mares, and it's estrogen that is then used in female women when they're going through menopause. And Provera is a synthetic form of progesterone. So both of these are generally used in traditional medicine.
So that would be something that a doctor might, MD
Oh,
doctor
definitely.
might recommend to a woman in
Certainly.
menopause.
Certainly.
And so then what would you recommend to a woman in menopause,
Oh,
like
well,
with those symptoms that he would give her that for?
the first thing I would do is really find out what's going on with that woman, specifically what her symptoms are, what her willingness to work with her diet, what her history is, her family history in terms of cancer, whether she's at risk for breast cancer, osteoporosis, cardiovascular. So I would look at and talk to this person to find out really what's totally appropriate for her, because there's a whole range of possibilities, ranging all the way from use of herbs on one extreme to use of the synthetic hormones on the other extreme. But I have the option of using natural hormones that are taken from plants.
They take them from plants?
They take them from plants.
Well, that's pretty.
As opposed to pregnant mares.
I think I prefer a plant. Thank you.
And they're very,
Sounds
very...
like it would be more agreeable with my body.
Well, yes. For many women, they are. For many women, it's truly a godsend to have these options.
Well, I certainly know they helped me. You know,
Right.
The ones that you recommended to me, they've helped me a lot, because I was very uncomfortable and going through a lot of physical uncomfortableness. And Julie put me on some natural, what are they called?
Natural plant hormones, phytohormones.
Phytohormones.
Phyto
yeah.
meaning from a plant.
But they have they have different hormones in them.
The plants.
Yes.
Yes, as a matter of fact, the wild yam, which is what a lot of the natural hormones are taken from, also out of interest in the soy plant. The soy plant and the wild yam are used for natural hormones, to extract natural hormones. And an interesting thing to know is that the wild yam plant, something like 400 different drugs are extracted from the wild yam plant from their natural form and then made into synthetic forms.
Wow.
Very interesting.
That is interesting. You know, I think that that's another good point, Julie, because most people really don't know that. They think of natural medicine and they go, oh, they're doing foo-foo with plants, you know. But really, most people don't know. They're not aware that the basis of the medicines that they get start with that plant and then become synthetic by having, going through chemical laboratories, having things added to them.
Not always, but
Not
many.
always,
many.
but a lot of them.
That's right.
Right, and so
Yeah.
I think most people don't know that. You know, I think I'm happy that we get to say this,
Yes.
you know, so that people can become more aware of that. I think they also don't realize, they think about natural medicine. They think they can just go to the health food store and buy natural medicine. So why would they come to see you for natural medicine?
I encourage, in fact, one of my main purposes is teaching. When I do my lectures, I try to give people information that they can go to the health food stores and use certain herbs and things that are not harmful for someone who's not complicated. You know, if things are simple.
Right, I understand.
But a lot of times things are not simple. You know, say a woman has been bleeding for 10 days in a row or 2 weeks, so she's bleeding every 2 weeks and losing a lot of blood, or she really needs some professional assistance. And so that's, women will come to me when they can't really do it on their own, and they need some professional assistance to evaluate what's going on and to choose, to help them find the most appropriate avenue for their healing.
I truly think that part of that professional assistance is also dealing with the emotional part of it, understanding that that's okay and that it can be assisted. You know, because many times I think when I see women get to that point, they're not thinking about going to the health food store to buy herbs. So it's so wonderful that you're telling them to do that.
I mean, look at both.
Right.
Go to the health and start by herbs and looking
And
at the emotional.
deal with those emotions.
Yeah, and you know, there's been a time when maybe 40-60% of my practice was just working with the emotional underlying aspects of what was going on with the woman.
Mhm.
And I found it interesting. I've done a lot of work with PMS over the years,
Really?
a lot of work. And there was a time when I'd set up the physical program, you know, things like maybe magnesium and Evening Primrose Oil or natural progesterone, and then started working on helping a woman express what was going on emotionally, or maybe not even express it, but discover it, what she was feeling inside.
Exactly.
And I literally, over a period of months, as women would become more aware of what was going on inside of them, watched the PMS diminish. I mean, it's amazing
I
how
understand.
everything interplays together. Don't you find that in your practice?
You know, I've just been working with a young woman, and she just said to me the other day, she said, "I'm so excited. We've gone through all these, and I just finally had a regular period. I haven't had one in years." You know, but we've been dealing with these emotional issues, and so I absolutely do. It's very important.
And so sometimes it's a matter of just getting the right nutritional and exercise and supplement and perhaps natural medicine, and letting that do its work, and then getting to work on the deeper issues.
That's right. And so PMS, Julie, when you say you do a lot of work with PMS,
Yes.
what is PMS?
PMS. Well, PMS, Airielle, means premenstrual syndrome, in case any of you don't know that. And I think I'd like to give you an example, perhaps best, of what PMS might be. Of course, it could occur in many different ways, but for example, a woman might come into my office and say, "You know, it seems like I'm dealing with my menstrual period all month long. I bleed for 5 days to a week, then I have a week off, I feel great, and then all of a sudden I feel bad again. I start to feel tired, I feel bloated, I start craving sugar, I eat terribly, I don't want to exercise, and I'm irritable and bitchy. My moods go up and down. My relationship, everything seems worse than what it seemed like the week before, and I don't feel like myself." Well, I think to myself, this sounds like PMS.
I know those symptoms.
Right, so that's an example of PMS.
Yeah.
I mean, there are certainly other examples, but so this could happen any time. It can last as long as 2 weeks for some women.
2 weeks out of the 4-week cycle?
2 weeks out of the 4-week cycle
That's a
before the
long
menstrual
time.
period. It affects dramatically people's relationships and jobs and lives.
So you must have a lot of men very grateful to you.
That's true. It's true.
Don't men go through something like this as well? I mean, I know that's a whole nother subject.
Yeah.
Okay, we'll go back to PMS.
All right.
So I know you have some more information for us about PMS, Julie.
This is one of the charts that I use. This is just a piece of a chart from a lecture on perimenopause that I use, but it's pertinent because in perimenopause a person just oftentimes gets PMS symptoms more and more. So I don't want you to get too hung up on all the details.
What is perimenopause?
Okay, perimenopause is actually could be up to 10 years leading into menopause.
Mm-hmm.
Which is around, peri means around menopause or leading into menopause. So
thank you.
You're welcome. So in speaking about PMS, the woman that I saw, remember her symptoms, everything was pretty much okay until her the middle of her cycle. Now the middle of the cycle is generally where ovulation is taking place. So it's interesting to note, and there's certainly been a lot of studies on this, and I would like to emphasize that I'm not talking about 100% of all women, but for many, many women, this is the case with PMS, premenstrual syndrome, is that instead of, in a normal cycle, the first half of the cycle is dominated by estrogen, and the second half of the cycle is dominated by progesterone, okay?
Wow.
when ovulation happens, then the corpus luteum, which is in the ovary, starts to put out progesterone. Now, many, many women are not ovulating all the time, or have problems with ovulation, or have problems with this part of the cycle, all having to do with progesterone. Not all women, but a large percentage. If you introduce natural progesterone into the situation, into their intake as a supplement, it helps the PMS, balance the PMS. This is just a piece of it. And in addition to that, I want you to be clear that that's not the whole picture. There are often problems with digestion and elimination. Like, for instance, women may have constipation.
Many times.
Many, which is also contributing to PMS. We've already spoken about the emotional, certainly, which is aggravated by the hormonal. Also, there can be certain nutritional deficiencies, like magnesium, for instance. Oftentimes, there's a magnesium deficiency, which, interestingly, many women crave chocolate.
Absolutely.
And you know what they... one of the theories is that they're craving chocolate for the magnesium.
I thought it was for the love, Julie.
And the nurturing.
And the nurturing.
That too. Well, so you killed two birds with one stone. So I would like... the picture is complex sometimes. It's not just a matter of hormones, but hormones can play a large part, as well as nutritional.
It certainly is complex.
No, very.
And we, as you have said already, we have to remember that everybody's different.
That's right.
You know, not everybody needs to take the same things and do the same things.
And not everybody...
or experiences the same things.
And not everyone even has the same hormonal imbalance.
Exactly. Maybe you can show us some of these natural medications that you're talking about.
Oh, I'd love to.
Great.
Why don't we go into my pharmacy?
Okay, let's do that.
So this is the pharmacy, Airielle.
Looks like a pretty interesting place.
There are so many things. All these cupboards are just filled with different herbs and supplements and glandulars and certain mixtures that help people with different things.
That's really exciting.
I've had to develop my own pharmacy because these things don't exist in a lot of places. So we were talking about...
I'm impressed. Lots of bottles in here.
Lots of bottles. So we were talking about PMS.
Right.
And I thought I'd show you, for instance, this is an herb called dong quai. This is a Chinese herb, and I often use it with PMS. It's a very balancing for the woman's reproductive system. It feeds the ovaries and the uterus, and it's a wonderful herb for premenstrual, menstrual. You're probably familiar with it.
Very familiar with it. I tell people to use it all the time.
Yeah.
Especially young women who are having symptoms with PMS. And menopause women, and
that's right,
perimenopause women, and
now, this is an example, this particular product, of a natural progesterone, which I often will use with PMS. This one is derived from the wild yam plant, and you take it under the tongue.
And you let it dissolve under the tongue.
Let it dissolve.
Like a homeopathic.
This is called thyrocomplex. This is a glandular of ground up thyroid, because oftentimes PMS goes along with a low subclinical hypothyroid, where a person may not show low thyroid on a test, but they'll have symptoms of low thyroid. And oftentimes with PMS, I'll use some kind of a thyroid with that.
So when you say that's a glandular, what does that mean, Julie?
A glandular means different glands, like the thyroid is a gland.
But where do they get it?
Glandular. Oh, this particular one is, they grow animals, especially in New Zealand, that are organic. They grow them specifically, and they take the organs and grind them up and put them in tablets in order to nourish those organs in our bodies. Very, very old, ancient, not ancient, but old.
Way of doing it.
Of healing. Another interesting, something I use often with premenstrual is the Evening Primrose Oil, which often helps bloating and premenstrual symptoms.
What does it do, basically? What is
Oh, it's
Evening
it's
Primrose?
it's actually pretty complex to get into the chemicals.
Okay.
Some women just don't have the ability to. They don't have the enzyme that actually will allow this to happen naturally in their body. They're missing it.
Boy, Julie, there are so many different things in here. I really am blown away. I really want you all to come in here and see these. So, Jason, bring that camera in here and let these people see all these things in here so we can get out of here because it's hot in here.
All right, let's go.
Which means I have to go in.
Oh, it's much cooler. Boy, it's hot in here. Could have been gynecology.
Do you do gynecological examinations?
I do gynecological examinations. I can do cultures and cabs. I don't do things like biopsies or DNTs, that kind of thing, but I can do a routine cab or do mammograms. Vaginal, look under a microscope and vaginal discharge and
Like this would be
that's right.
Where's the microscope, Julie?
Hey,
The microscope's right here, Jason.
look, there's a microscope.
Oh,
Ta-da.
oh. Boy,
But Julie's got all kinds of medical-looking things around here.
that's nice. So you have everything here.
Well, I have everything I need to.
You girls are holding the
We're not
microphones.
plugged in.
You know it's going to be fun? The people at home will love this because those mics, aren't plugged in. You
We
know
look
that,
like
right?
we're talking, right?
But you are talking. What's funny is the mics aren't plugged in because I came in here.
Right.
Boy, Julie, you sure have a lot of doctor-looking stuff here. What are these down here?
These are
Vaginal?
vaginal speculums because I do gynecological exams. And I even had this
On the table?
specially made with wood seat for the feet instead of
Wow.
metal.
Oh, wow, that's
doing-
nice.
Yeah. So
And so you examine the women, and then what do you do with the tests? Like if she has a discharge?
well, I can do a culture and send it to the lab, or I can look at it under the microscope, or do a PAP and send it in to the lab. I can order blood tests, mammograms. So I can do a full diagnostic workup.
So it's not just herbs.
No.
That's good to know,
Yeah.
right?
Yeah. We're sort of we're a cross between someone who can do just herbs and someone who can actually diagnose situations, diagnose and treat. In Hawaii, we're called physicians, which means we can diagnose and treat.
Now, these medications that we just looked at,
Mm-hmm.
do they need prescriptions of a sort?
Many of them, a lot of them not, and many of them are that you can only get through a licensed professional, like a chiropractor or a naturopath or an MD. Most of them do not need prescriptions as far as like a medical doctor per se.
Well, that was
So-
fun. That was
Yeah.
quite a room you have in there full
Exploration.
of goodies. I'd like to go. Yes, I'll have this, and this.
That's right.
Great
We
shopping.
mix up a little concoction and program for you.
I like that idea. So, how about if we go finish our conversation on your nice soft sofa?
Oh, that sounds good.
Okay.
Let's go.
This perimenopause thing, Julie, is very interesting to me because
Mhm.
I've not heard a lot about perimenopause.
Mm.
And I think probably if I haven't heard about it and I'm somebody who's very interested,
Right.
I think a lot of people haven't heard about it.
I think you're right. You know, a lot of times when I do my lectures, it's really one of the things that people are particularly interested in because, as I expressed earlier, it could be like up to 10 years
That's a long time.
moving into the menopause. And women feel sometimes crazy. They don't feel good. They go to their regular doctor. They do all the blood tests. They say, you're not in menopause. There's nothing wrong with you. And they say, but I feel awful. They're often given sleeping pills, antidepressive pills, suggested maybe why don't we just remove the uterus, put on birth control pills, a variety of things which many women are not very satisfied with.
So,
Well,
does the medical field recognize perimenopause?
I think that they're really beginning to pay more attention. I think the problem is that in terms of remember I was explaining with the chart around the balance between the estrogen and
Yes.
progesterone. Well, as a woman reaches, say, the age of, oftentimes by age 45, they're not ovulating anymore, or they're ovulating sporadically.
Wow.
And so this means that then the body's not producing progesterone. And if this goes on month after month, or even erratically, this creates tremendous changes, sometimes elongated bleeding in women, irregular bleeding, exaggerated PMS, like we were talking about earlier. Well,
But it's not PMS.
Well, these are all just definitions given
Yeah.
a group of symptoms.
But how do the symptoms differ?
Well, the thing that's often added in is irregular menstrual cycles, long bleeding cycles, or sometimes long, sometimes short. That gets added in, and then it's often elongated. That's when it can get up to maybe 2 weeks long, or lasting long. So the woman may be bleeding half the month and PMS half the month.
Mhm.
But the traditional medical, they sort of have a problem because they use what's called Provera, which is synthetic progesterone. This does not help a lot with well, it doesn't really help a lot with the symptoms of perimenopause, and it has side effects, oftentimes of depression and bloating, which is part of what a woman is already dealing with.
That's what she's complaining about, yeah.
Partly.
Uh-huh.
So they're sort of stuck there for a number of years. Often they refer to the psychiatrist or...
Crazy women.
Right.
Yeah.
Right.
So, well, what do we do about it from a natural point of view? How is that different from, I mean, just by using the natural
Well, very often that's a time when natural progesterone. Because and to restore the natural cycle, but not Provera. Provera is a different thing, and that's where there's a lot of confusion that goes on.
Well, what are the side effects of Provera?
Like I was saying, sometimes depression or bloating, whereas natural progesterone actually decreases bloating, often helps to change the emotional, even out the emotional state of a woman. It helps to regulate the cycles. It's a precursor to adrenal hormones. So if a person's under a lot of stress, their perimenopause can get worse and worse and worse.
So, Julie, we just have so many things that we wanted to talk about. We've been on a long time. We hope you've been enjoying this conversation and a little bit of knowledge, but there's so much more. So many things that we wanted to talk about. One of them that we've realized that we haven't covered at all or spoken about is post-surgical menopause. And that's really important for a lot of women who have surgery and then all of a sudden find themselves being told to take artificial hormones almost automatically. Like, here, take this. So what about that, Julie?
Well, I would like to clarify, we're not just talking about any surgery, but surgery where specifically the ovaries and the uterus are removed. Now, some women just have the uterus removed and the ovaries theoretically keep functioning. But those women who have had their ovaries and uterus removed, overnight they go into menopause. This is not a 10-year process. This is not a 10-year process of longer periods, shorter periods, getting used to it, the emotional, because there's also an emotional thing about for a woman stopping her menstrual cycle and being able to bear children.
That's right. She has a lot to deal with on that level.
Tremendous,
Tremendous
internal change. And this happens overnight for some women. And then they're put on synthetic hormones, basically, oftentimes Premarin and Provera, which I think they really do need to be on some sort of hormonal support, or their body goes through radical shift. But I'm happy to say that I have worked with women who have complete hysterectomies who can use the natural hormones
That's good
perfectly well.
That's
Yeah,
good to hear.
it
And
is.
it keeps them in balance.
Yes, yes.
That's wonderful. I really feel for these
Hmm.
women who are just all of a sudden at the age of 30 in menopause. You know,
Mhm,
it's
mhm.
what do I do?
Mhm.
And so Julie can help you with that.
As well as other people.
That's right.
As well as other people.
So do men have menopause, Julie?
Well, it's an interesting subject. It seems to me that from the information I've gathered that men do have menopause. It often seems to occur maybe 10 years after women.
Boy,
So maybe
they
around
held on
in
a
there.
while, huh?
Yeah. And it's a decline in testosterone. And by the way, women also have testosterone, which declines also during the menopause. Another interesting factor a lot of women don't know about, but it affects oftentimes their sexual desire, is as the testosterone goes down. But anyway, men.
They have a less sexual desire when the testosterone goes down?
Both men and women
Yeah, well, you know,
often have this
I think
experience.
that's why they say when you get the old man and the old woman that they're so much more in harmony
Mm.
because they don't have the outreaches of those
Mhm.
hormonal levels.
Mhm.
You know,
There's a more of a
coming in with those
similarity,
differences.
or
Right.
a
Mhm.
different stage that happens.
Yes.
But I find I don't work as much with men hormonally. I do work with men on other issues, naturopathically, but
Yes.
other naturopaths on the island do
Mhm.
work with men.
I think it's really going to be exciting to see what the future holds for us in the way of understanding these bodies and healing them and
Hmm.
rebuilding, regenerating them. You know,
Well,
and
we're the ones defining the new, like, we are the baby boomers who redefined natural childbirth. We talked about it. We had groups about it. We wrote books about it, and we're doing the same about menopause and
That's right.
change.
That's right. And the power of the elder woman. I see that
Mm.
very important at this
Mhm.
time. You know, and I stress that a lot because I find that as we come into this time period, we have a lot of wisdom and a lot of power and ability to help that we need to step into,
Mhm.
but also to recognize that we also, even more than ever, need the private, inner, quiet time as well.
Mhm. Very important.
Yeah, that's very important at that time.
And to just realize that there is a change and a transition, that women need to find their way as
Mhm.
individuals and together.
And it's quite a journey. I mean, for a lot of women, it's a whole different lifetime,
Yes.
if you will. I
Yeah.
mean, their children are gone, and that's a different stage in life.
Right.
So I really want to thank you so much for being here with us today. It's been wonderful fun and being here at your beautiful office. And we're up in Kula at Julie's office. And it's very lovely here. And we hope you've enjoyed touring around it with us, flying around this little office. And how can people reach you, Julie? You can definitely let us know at Maui Arts and Music Association how you feel about this program, and if you would like some additional programs like this, we would like to bring them to you at some greater detail. Yes?
Yes. I'm sure myself and other people would be happy to share more information,
Yes.
more in depth.
So please do give us your feedback and let us know what you're interested in hearing about and learning about. And you can contact Julie at Maui Arts and Music. You can also contact her at her home,
Yep.
her office.
Right, my
Pardon me.
office.
Her office number, which is
878-3267. You can call there. That is my office, and I do see people.
She sees lots of people.
I see lots of people.
Well, we thank you so much for all the people that you do see and the many people that you touch.
Well, I
And-
really appreciate it. And I appreciate the opportunity to be able just to pass on this information Because, you know what? Women and people have choices. We all have choices about how we take care of ourselves, and we need to be informed.
That's right.
Take all this information from me, from an MD, from different people, and take it as advice, and then follow our inner wisdom to take care of ourselves, basically. I'm just another piece, another perspective, basically.
Absolutely. I honor you so much for saying that. It's very important that we listen to what is right for us.
Right.
And take, if you will, all these pieces of information and bring them in and make them yours. You get a lot of calls, Julie, about this?
Airielle, it has just been overwhelming since I started doing the lectures. I do a lecture, and I often receive 4 or 5 new calls every day of people who are just so glad there's an alternative and they want to know about natural hormones, and please could they see me as soon as possible.
That's wonderful. I'm
It is,
so
but
glad
there's
to hear
only, there are other people that are doing some of this work, yet there's only one of me.
That's right.
And I have a difficult time seeing everyone one-on-one. And so that's why I do the lectures. That's why I'm here with you today.
Exactly.
I want to get the information out. And so if you want to hear this information, pay attention. Look for posters, lectures, and dates. You might call the
Maui Arts and Music Association.
Maui Arts and Music Association.
The numbers will be on the screen at the end of the show.
Great. And perhaps sometime we'll be able to have a program. If you're interested, let us know that you want to hear more on perimenopause or menopause, and perhaps we can do a program just on that, more
We'd
in
really
depth.
like to.
Because I can't do all one-on-one.
So Julie, as she just said, does do lectures, and you will see those lectures posted, the times and dates for them, and you can also call Maui Arts and Music for that information.
What's the number, Airielle? Do you know?
573
573-3100, I bet.
573-3100. So do you know when your next lecture is going to be, Julie?
No, it's not. I just did one about a month ago up at Haleako School, but my next one will probably be, my guess is September, October, probably at the Cameron Center.
So in that vicinity, folks, September,
It'll be in
October.
it'll be advertised in the Maui News. It'll be all over the place.
And if you have a specific show request for us, please do let us know. Thank you.
Thank you.
So we thank you again for joining us, and God bless you.
Aloha.
Aloha.